break from Wendy right now because the mayor is getting ready to brief the district on what is the latest. So let's go ahead and listen into the mayor, and then we'll see you in a few minutes, and we will recap and get back to Wendy.
Good morning. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and this morning I'm providing an update on the district's response to COVID-19. I'm joined by the D.C. Health Director, LaQuandra Nesbitt, the Deputy Mayor for Public Safety and Justice, Kevin Donahue, our Incident Commander and Director of DCH SEMA, Christopher Rodriguez, and Christopher Geldart, who is leading our operations branch of the Emergency Operations Center. Today, we are going to focus on the district's efforts to protect vulnerable populations in Washington, D.C. It's a bit of a longer of an update, but we think it has very critical information for people who are particularly susceptible to COVID-19. This morning, we reported 139 new cases in the district, bringing our total cases to 2,197. And we also shared that we had 5 additional deaths, bringing our total loss of life to 72 Washingtonians. Today, we also began sharing the numbers of lives lost among our vulnerable populations on coronavirus.dc.gov. And we added several categories, including individuals in the homeless services system, individuals in care at St. Elizabeth's Psychiatric Hospital, residents in the custody of the Department of Corrections, and residents in the custody of the Department of Youth and Rehabilitative Services. We continue to see how our positive cases are broken down in each of the district's 8 wards, and we continue, of course, to share everything that we know about individuals' race and ethnicity. The data from the last several days continues to reflect very significant disparities in how this virus is affecting African Americans, both in our city and around our nation. We're going to continue to call attention to these disparities here in D.C. and continue to call for national data collection, especially among national private labs during this phase of our recovery in response to the pandemic and moving forward. And of course, when we get to the other side, we need to focus and continue to focus on generations worth of economic, housing, educational disparities that have led to these very tremendous disparities that this pandemic is putting a spotlight on. We, of course, cannot wait until the pandemic is over to make every effort to change the trajectory of African Americans in our city. And today's mayor's order will, we think, go even further to protecting our most vulnerable populations. It puts in place a number of protocols to protect vulnerable residents from the coronavirus, and also clarifies earlier orders. For example, the order will require masks for hotel workers, guests, and visitors, individuals using taxis, ride shares, private transportation providers, workers and customers of food sellers, and strongly encourage for workers and individuals using public transit. The mayor's order also extends our public health emergency to May 15th, May 15. On Friday, we're going to share more information about our schools and government operations as best we can, but we know that we will need until at least May 15th to continue flattening the curve. And to help protect African Americans who we know are disproportionately suffer from some of the underlying conditions that make COVID-19 so dangerous, this mayor's order also charges the DC Department of Healthcare Finance with identifying residents who may have an underlying health condition that makes them more vulnerable to severe illness and death from COVID-19. Then the agency will conduct outreach to those individuals to provide them information on steps that they can take to lessen risk of contracting the spread of COVID-19 and determine whether the individual has symptoms of COVID-19 and provide information on any medical care, case management, or other support that may be appropriate for individuals who are at heightened risk. I've quoted Dr. Birx before in saying that we have to be almost perfect to flatten the curve according to some of the White House's estimates. And I want to thank DC residents and businesses who have been doing everything that they can to flatten the curve by staying home. But another way to strive for excellence is to overcome long-standing health disparities experienced by African Americans. And one famous such medical expert and Washingtonian was Charles Drew, who said excellence of performance will transcend artificial barriers created by man. And so we continue to be charged with doing all that we can and all that we must to equalize opportunities and experience for African Americans in our city. We aim to protect DC residents and save lives, and that means doing everything we can to protect our most vulnerable residents. The remainder of the slides will talk about those vulnerable populations. And they include residents who are in the custody of DC government, residents who live in congregate settings like nursing homes or group homes, residents who stay in our shelter system or who are unsheltered, and it also includes residents who are at home and in vulnerable situations because of domestic violence, or because they have a mental or behavioral health need, or because they're children who may not be in a safe home. So you can see, if we can just go back a little bit, you can see the residents who are in the custody of DC government are in DC Corrections or DC Jail, the Department of Youth and Rehabilitation Services, and we have 2 facilities, New Beginnings in YSC, but we also have young people who are in the custody of DYRS who are in community-based settings in St. Elizabeth's Hospital, which is our hospital. We also have residents who are in community-based provider care, often supported by DC government, and those include long-term care and intermediate facilities, disability service providers, and home health service aides who are providing direct care to DC residents. We also have residents who are in one of our homeless shelters or who we serve who are unsheltered. And we have residents who are at home, who have mental and behavioral health needs that we support, seniors who we support through various programs. We know that we have young people and people of all ages who may be experiencing domestic violence and who need resources. And we have others who are homebound who can't get out of their home. So those are a number of the vulnerable populations that we'll talk about today. So I first want to share some information about how we are protecting residents in our custody. And you can see now we're first talking about our criminal justice system. And you will frequently hear 2 terms, referred to at DC Jail. We have two buildings. The Central Detention Facility, which is the largest, its current population is just over 1,000 people with 1,043. And the Central Treatment Facility, and its current population is 398 people. And when Kevin speaks, Deputy Mayor Donahue speaks, he'll talk to you about our entire experience in addressing the pandemic in DC Jail. Also, New Beginnings, one of the DYR's facilities, currently has 22 residents, and the Youth Services Center has 20 residents. And on Monday, I shared with you that we lost a first resident, first inmate of the DOC facility. And yesterday, we also shared that we have 56 confirmed cases at DOC facilities. 32 residents are recovered and were cleared to return to the general population. Of course, the question is, how are we mitigating the spread of the virus? And so I'm going to talk a little bit about some practices that have been in place at the DOC to do exactly that. In addition to screenings upon entry, the use of quarantine and isolation, and the enhanced use of PPE, the DOC has modified its resident movement and activity to reduce the risk of transmission. Currently, residents are only moving from their housing units for court appearances, medical and dental appointments, work details, and legal visits and calls. In terms of our DOC population, we are making changes where we have local control to do exactly that. MPD, for example, has arrested fewer people, down from the average of 92 arrests per day before the public health emergency to about 29 arrests per day last week. We are also using good time credits to make more residents eligible for early release. And in the past 4 weeks during our response, the jail population has dropped 22% by about 406 inmates. We have also focused on reducing our youth population in DYRS facilities. Over the last 3 weeks, DYRS's population at New Beginnings and the Youth Services Center has been reduced by 40%. And those facilities are taking a number of steps as well to protect young people who live there, including testing and isolating any young person with symptoms, quarantining new residents, and ensuring PPE is provided and used in accordance with CDC guidelines. And so DYRS continues to take those steps to keep the young people in their care safe. Of course, DOC and DYRS residents are not the only residents in our custody. We also have vulnerable residents living at St. Elizabeth's Hospital, and sadly, 4 residents of St. Elizabeth's have passed away due to COVID-19. Currently, 9 of the hospital's 12 units are on quarantine, which includes about 60% of the patients. And you can see as well that we have 28 positives among our St. Elizabeth's patients, and we have 47 positives reported among personnel at St. Elizabeth's. In addition to ending most in-person visitations, as we have done at our other facilities, the Department of Behavioral Health is also working to accelerate the discharge of patients where clinically appropriate by prioritizing them for supported housing in a mental health residential placement. Since March 20, 7 patients have been discharged, and another 4 are projected to be discharged from St. Elizabeth's. In addition, residents who are in custody, we also have other vulnerable populations, which I mentioned earlier. Populations living in congregate settings such as nursing homes and group homes for residents with intellectual disabilities, as well as residents who receive services in their homes. So we'll talk a little bit more about those community-based providers. Nursing homes have been a focus of this pandemic. We have seen how quickly the virus can spread in these congregate settings, and given the advanced age and often complicated medical histories of the residents of nursing homes, it can be particularly fatal. And since we witnessed this tragedy in Washington State, we have been focused on how to support our nursing home providers. DC Health is working with our long-term and intermediate care providers as well. Skilled nursing facilities and assisted living facilities are instructed to report every case of resident or staff infection to ensure that they are getting the proper guidance from DC Health. Additionally, staff observe residents in these facilities for symptoms every 4 hours, and residents who display any possible symptoms of COVID-19 are to be tested. The Public Health Lab is supporting this testing. We have also provided these facilities with PPE, and there you can see how much and what has been distributed. And DC Health is also providing tools to help facilities conduct risk assessments, including information regarding staff leave, resident quarantining, and monitoring of symptoms. This week, DC Health and the CDC visited several long-term care facilities to offer support and gain a better understanding of how guidance is being followed. And this was one such federal investment that I acknowledged earlier in the week in a call with the Vice President. They do these sites, when they do these sites visits, they are looking at everything from how much hand sanitizer is being used to how we can better support testing for residents and staff. As you can see, I think the list before you are all of the long-term care facilities in the district. Some of them will be very familiar to DC residents, including Carroll Manor, Forest Hills, Inspire, the Little Sisters of the Poor, Knollwood, Lisner, Lewis Hurt Home, Starter Global, Thomas Circle, Transitions, UMNC, and another unique facility. So there, these facilities report that a total of 30 employees have tested positive for COVID-19, and 78 residents have tested positive, and they continuously are testing. So that is today's information on testing. In addition to our long-term care and intermediate care facilities, we are also supporting our home health providers and our disability service providers. And it is vital that people under their care can continue to safely access services. One of the ways we are preventing the disruption of services is by providing PPE to home health care workers and providing additional flexibility around services and hiring for providers who support our residents with intellectual and developmental disabilities. Another very vulnerable population that we are focused on is our residents who are experiencing homelessness. And we know that homeless shelters pose a particular risk, and similar to other congregate settings we've spoken about, we're exploring every option to make them safer for our residents. Sadly, 4 residents who are part of the homeless service system have died due to COVID-19. 2 of these residents passed away in a hospital after being admitted, and 2 residents passed away in the community. We know that we have cases at several shelters around the district, and we're very focused on how we support those who have tested positive, as well as our entire shelter population. One of the things that we did at the very beginning was to establish a remote quarantine site. These are hotel rooms that we are providing to residents who need to quarantine or isolate but don't have somewhere safe to do that. Right now, we have 284 people in remote quarantine, and 229 of those people are from our homeless services system. So you see there that we have tested and found positive 62 people. 225 people are in remote quarantine. Most recently, we also began proactively working to remove some of our medically vulnerable people who are in shelter into hotel rooms. These decisions are based on age, underlying health conditions, and a medical assessment. We have talked previously about other interventions that were made to make the system safer, including keeping our low barrier and emergency shelters open 24 hours a day to prevent a lot of movement among our homeless population between various facilities. Also requiring residents to sleep in the same bed in the same shelter each night, making meals grab and go, providing PPE to shelter staff, and the installation of hand washing stations and porta potty stations around the city. Before we talk about what comes next, I want to take a moment to thank all the workers who are staffing the facilities are talked about today. They are providing frontline services, in some cases medical services and first responder services, but certainly essential services to vulnerable people in Washington, D.C. And I want to thank them for all that they're doing each and every day to make sure that our residents are cared for. They are so important in the work that we do to flatten the curve and to save lives in D.C. We talk a lot about how people are staying home. And we know home is not safe for some people, and others don't have a home. So that is the real, true work of government to make sure that we're doing everything that we can for the most vulnerable among us. On Monday, this is part of what's next in serving our vulnerable populations. When we were last together, we talked about 2 new rapid testing instruments that the public health lab now has. Our public health lab primarily does high volume testing and doesn't necessarily need these smaller instruments in the lab. So Dr. Smith, who is with us on Monday, and Dr. Nesbitt are working together to think about how we can deploy our rapid point of care instruments to do targeted testing in our vulnerable populations. So this may be in a shelter or nursing home. This testing could help us quickly identify those who are infected and more efficiently move people into isolation and medical care. I also want to acknowledge, as I did at the beginning, that we have vulnerable residents who are living in their own homes, and we want to make sure that they get the help that they need too. And we have some different hotlines to make available to you. So I make these numbers available for people who directly need the help, but also for neighbors and friends and family members who have some concerns for loved ones or people in your lives or people in your neighborhood. Those in need of mental health support right now can call our mental health hotline at 1-888-793-4357. If you're a victim of domestic violence, you can contact the DC Victim Hotline at 844-443-5732, or you can discreetly contact the police by texting 911. Seniors can reach out to Department of Aging and Community Living at the Call and Talk program by calling 202-724-5626. And again, residents who are homebound due to COVID-19 and in need of food or shelter, food or essential items can reach out to our hotline at 1-888-349-8323, and we will direct you to the help that you need. Finally, on this Thursday, we have a holiday in the District of Columbia. It is DC Emancipation Day. And I just want to read you why it is so important to Washingtonians. On April 16, 1862, President Abraham Lincoln signed into law the Compensated Emancipation Act that freed all enslaved persons in the District of Columbia and effectively abolished slavery in the nation's capital. The Compensated Emancipation Act freed enslaved persons in the District of Columbia 9 months before Abraham Lincoln signed the Emancipation Proclamation, declaring the freedom of all enslaved persons in the Confederate States. The District of Columbia Emancipation Day Amendment Act of 2004 officially designates April 16th as a public holiday in observance of the anniversary of DC emancipation. On April 16, 2020, it marks the 158th anniversary of the Compensated Emancipation Act. And in observance of this historic event, virtual celebrations are taking place throughout our city, demonstrating our steadfast commitment to raise awareness about our rich history and about the ongoing quest for justice, equality, DC statehood, and full participation in our nation's democracy. So with that, we are available for your questions. Yes, sir.
Professor Malik Marco with CNN. I just wanted to ask how the extension of the emergency until May 15th is reflective of your changing perception of what the peak is, and if you could just speak to that changing estimate of the peak.
Well, let me see. You said Alex?
Yes.
Alex, we are, and I will ask Dr. Nesbitt to address this, but we are looking at our data every single day and responding to what that data tells us about how many people are being infected, the number of hospitalizations, the beds that we'll need, and the supplies that we need. That is the primary purpose of that modeling, to make sure that we are medically necessary. And I've mentioned a couple of times this week that the number of infections today is less than what we thought the number of infections could have been based on our modeling. And that is because our residents and businesses are making tremendous sacrifices to flatten the curve. We know that most of our orders go through April 24th, and we have a lot more work to do to flatten our curve to make sure that we can save lives in the District of Columbia. So we will be, based on today's order that I'm going to sign, extending that by 3 weeks. And I look at that as a check-in point. I don't know that that means that we're going to be open on May the 16th, but it will be a point for us to check in. And if we need to extend it beyond that, we certainly will. Yes, Sam.
Yes, Mayor. You talked about masks, and I've gotten a call from people saying that they were not allowed to go in a particular store because their mask was unacceptable. And my response to them was that your order didn't say mask. It said mask or mouth cover. Particularly now, it seems that basically if you do any business in the city, you're supposed to have a mask on or some kind of covering. Could you explain that? Is it a mask or mouth covering? What is acceptable? I'm
going to ask Dr. Nesbitt to fully talk about masks, but just to get started, any business who's not allowing somebody in because they're having a face covering is not compliant, and we want to know about them so that we can properly educate them. So if you can share that with us, that would be really helpful. Dr. Nesbitt.
So we have provided guidance around the use of masks or face coverings. So we want to make sure that the mask covers the face, including the nose, so nose and mouth, and that it fits snugly. So we really want people to know how to use the mask appropriately. What our guidance focuses on is the use of face coverings, which can be homemade. So as the mayor has mentioned, we want to make sure that any businesses who may be denying people entry because they're looking for a specific type of mask, or instead of a mask or face covering, can become more familiar with our guidance. The reason why that is critically important is that the conservation of the medical and surgical mask for the healthcare provider community or people caring for individuals who are sick with COVID-19 is critically important. And we are encouraging members of the general public who are out conducting essential activities and going to businesses, retail food locations, using the taxis, rideshare, private transportation, and public transportation services, would use the cloth or face coverings or the homemade face coverings. So being familiar with how to use those appropriately, how to cover your face appropriately is critically important. So we want to make sure that everybody knows who should use which types of mask, and we provided that guidance. We've also have a guidance document on our website that says which types of masks are appropriate for essential employees of non-healthcare related businesses. So that can give guidance to businesses who employ people who must still work, but are not in the healthcare sector providing care to individuals who are sick with COVID-19. So they would know which types of masks and face coverings are appropriate for the workplace.
So we will attach with the order to make sure it's all in one place and easy to find, all of the health guidance that we've already issued around masks along with the order.
Of course, there was a lot said there, but a bandana tied around your face that covers your nose and mouth, is that acceptable?
We have the guidance in terms of how to use that on your face in a way that is appropriate. So if it is loose in a certain manner, we would not want you to use it that way, but a bandana can be used appropriately as a face covering.
Yes.
Supervisor, could you clarify May 15th? What exactly are you extending until? What restrictions will stay in place? That covers schools?
We're extending everything until anything, bars, restaurants, mass gatherings, modified government operations, schools, stay at home. So all of the previous mayor's orders that respond to COVID-19 will be extended to May 15th. Keeping in mind that the authority I have from the council at this stage runs through June the 8th. So if we need to extend beyond that, which is entirely possible, we don't have to go back to the council if it's a shorter period than June 8th. Yes.
Mayor, and just to follow up on Mark's question, the May 15th then includes schools?
Everything.
Everything? Okay.
Yes, and then we hope to have more to say about schools on Friday. Our public education team is working on several different scenarios for schools. We will continue to consult with health, and we hope to have more to say about schools on Friday. That more may be that we'll say more on May the 15th, but we want to provide families with an update on Friday.
And if I could ask again about masks. In your new order, it said workers and customers of food sellers. Now, last Friday, you had put into effect masks for people who were shopping in grocery stores. And if feasible, the grocery stores were to provide masks and gloves to their food workers. You've taken I don't see that feasible now there. So you're saying that they're required, workers inside these food stores are required now to wear PPEs.
Yes, and I don't think this order relates to gloves, masks. don't have.
Correct. So gloves are a different type of personal protective equipment, and we want to make sure that everyone is clear around talking about PPE as a global construct. So
This is about masks.
mask, correct. So we give guidance around the use of gloves to specific audiences where appropriate.
And based on the information you're getting from everything that you've been able to see here, are people complying with your masks ordered?
Yes. That is my personal observation. That's the observation that we're getting from our teams, that people are complying. Listen, people get what the stakes are, okay? When we talk about the disproportionate impact on African Americans in our city, we also know that African Americans are disproportionately providing frontline services. So if we're concerned about Black people dying from COVID-19 in Washington, D.C., everybody needs to do their part. If you want stores to continue to be able to serve you food, everybody needs to do their part. That's the people going shopping, and that's also the vendors. And as I mentioned, I think people are doing their part, and we're going to continue to support them in the best ways we can. Yes.
Does each, at the DC jail, does each residential unit have their own personal bathroom? And if not, how often are those bathrooms being disinfected?
Kevin?
That's correct. At the DC jail, in the CDF, each individual has their own bathroom. Common areas are disinfected every 2 hours. Those things that are in the cell are disinfected when the individuals in the cell have a chance to leave the cell, which is generally once a day.
Kevin, I didn't get a chance to talk about the number of federal partnerships and the role that the Superior Court and Judge Morin has played. Could you comment briefly on that?
Sure. In fact, this morning I was on the phone with Judge Morin as well as other federal partners. So the mayor had mentioned two populations that DC has some discretion over in terms of who's at the jail. One is the police practices for arrests, and the other one is the use of good time credits. The Parole Commission has a number of people at the jail, as does the U.S. Marshals. Judge Morin at Superior Court is allowing for individual requests for release to go to individual judges, which is how they're reviewing the population. They're on a case-by-case basis.
Yes.
Mayor Bowser, the president has been suggesting that he's the one that can call the shots on when to reopen society, when to have it extend closures. What's your response with him that he's the one that can call?
Well, I think his comments yesterday contradicted his earlier comments.
And I know one of the things with the data is when we see the deaths and the new cases today, it's kind of reflecting what was happening earlier. At what week are we looking at to see if we are flattening the curve and if all these measures that we've been putting in place are paying off? Like, do we want to see it decline by the end of this month? Do we want to see it in early May?
We want to see it tomorrow. I mean, that's what we want. We want to see the decline tomorrow. I'm not sure I understand your question, Finnett.
What I'm getting at is, like, at what point should we expect to see the declines relating to the stay-at-home order and all the various social distancing requirements? Since there is the incubation period, and for deaths in particular, it may take more than 10 days for someone to reach the point of death.
Well, I think that this is my non-medical assessment, so I'll turn to the doctor, but we're seeing the benefits of keeping kids at home, closing essential businesses, mass gatherings. All of these interventions were put in place in mid-May. In mid-March. So I think you're right to suggest that there is some period between intervention and effect. And all of those major things happened in Washington, D.C. in mid-March. So I think that we're seeing the benefits of those things already.
So in the mayor's earlier response, as she mentioned, we do projections in terms of what we expect to see in terms of the number of people who will be infected or the number of people who will present with symptoms in terms of the estimate of cases. And we are starting to see that the number of cases that we estimated and the number of cases that we are confirming, we are below what we were projecting, which is indicative of we are seeing the benefit of the social distancing measures we put in place. That being said, we have things that we look for to be able to say that we are seeing the type of progress that is indicative of us being able to make some more definitive decisions, which is what goes into the calculus of how I understand your question. So we have to be able to see persistent declines in the number of new cases for a 2-week period of time. And so you'll hear a lot of public health leaders and officials talk about this. You hear Dr. Fauci talk about what are the signals and the signs that we need to be able to see. So while we can be reassured and be optimistic in that the number of overall infections in the district that we're seeing is below what we were projecting initially, which are reassuring signs that all of the steps the mayor took are paying off and having benefit, we still need to be able to observe a persistent decline in the number of new cases that we see.
Yes.
Dr. Smith, could I just follow up and ask why how your modeling might be different from others and why? And then to the mayor, just given the number of federal workers who are DC residents, how do you think the federal government, or how are you hearing the federal government is being impacted, considering how many residents are federal?
Give me the last part of that question again.
Given how many federal workers are DC residents, what are you being told, and what are your observations in terms of how the federal government is being impacted because of the coronavirus situation in DC? And then just to Dr. Nesbitt, I wanted to ask why you think your modeling might be different from other models out there.
Okay, and we do have a considerable number of federal workers in this region, in DC, Maryland, and Virginia. But the vast majority of federal workers are outside of DC in states all across the United States of America. And I think my observation is that federal workers are teleworking, which is a good thing because they are, they're stopping the spread. And I think they made those decisions around the same time that we made our decisions to put our employees on telework. If it wasn't exactly the same day, it was close to it. So that was a good decision for the region. It's also good because those workers are working and they're not out of work, and that's a good thing.
Mayor, we have 2 questions.
Okay, the first part of your question is about which models and...
Yeah, and I can't necessarily point to another one, but DC's models have been slightly different from other models out there, so I was just wondering how you believe that your model and then your estimate of the peak, why it's different than other models.
So there are, as you mentioned, several models that are out there, and quite a few of the states in our region are using similar models. The vast difference in most of the newer models that have been created, and I think the initial model that most people are familiar with is Washington State's model, is that the newer models take more into account the age, allow you to use in your model the age of your actual population, as well as looking at the impact of social distancing measures in a more concrete way. It's probably the best way for us to describe it. The other thing to note too is that and you'll even hear members of the White House Task Force talk about this, is your models are models. They help us plan for the future, but we also have to look at the things that are happening on the ground in our community and use all of those things in concert to inform our future planning.
So Mayor, Amanda Gomez, City Paper.
Okay. Amanda?
Hi, thank you for holding this presser. I have 3 questions about St. Elizabeth. My first is, you said that 9 of the 12 units are under quarantine. Does that mean these patients can't leave their rooms? And I also understand there's a quarantine unit with 7 rooms, and that the hospital is having to step up, and that there's no negative pressure rooms in the hospital. So can you just talk a little more about quarantine?
Yes. So a couple of things. So each design of every facility is designed different, and St. Elizabeth's has some unique characteristics in its design. So when we talk about the 9 of the 12 hospital's 12 units are on quarantine, what it means is that the individuals on that unit and the hospital staff who care for that unit do not have any ability to mix with patients who are on the other 3 units. So that's what it means for them to be quarantined. And so they're separated from the rest of the facility. They also should not have activities in groups or congregate settings, including meals. And if they have activities that are required for them to be able to have time outside of their room, their patient care setting, that should be limited to 1 at a time or in very small group settings. So that's what it means to quarantine a unit.
And I know the nurses are concerned that there are no negative pressure rooms at the hospital, and that I know the nurses union also said that 30 nurses are out on quarantine, creating major staffing problems. So can you just address those 2 problems that I know the nurses union have said?
So one of the things that is important to remember about St. Elizabeth's as a hospital is that an individual in St. Elizabeth's Hospital does not necessarily mean that the individual is hospitalized for the treatment of their COVID status. So when we talk about the need for a negative pressure room for the treatment of COVID-19, that is not the care that they would be receiving at St. Elizabeth's Hospital, which is an aerosolized procedure, et cetera. So the number of negative pressure rooms necessary at St. Elizabeth's Hospital, which is a psychiatric hospital, is not necessarily the same that is required for an acute care hospital that would be providing treatment for the COVID-19 condition. So recall that for many of the individuals who are in St. Elizabeth's Hospital, but for their COVID-19 status, these individuals would be recovering at home. But for their psychiatric diagnosis, many of these individuals would be recovering at home with their COVID-19.
Okay. And the staffing problems, are there plans to get more support in there, or is the 7 total personnel out okay?
We have worked directly with the leadership of St. Elizabeth's to ensure that they have adequate staffing as well as adequate personal protective equipment to care for the patients in their custody.
Thank you. Is anybody next on the phone?
Nathan Baca, WUSA 9.
Okay, Nathan?
Yes, I have 2 questions for 2 separate reporters. First one, there have been multiple positive cases of COVID-19 at Whole Foods on P Street, and according to DC Health, essential businesses are not required by law to notify public when an employee tests positive. Can you explain why that is, and wouldn't notifying the public of these positive cases help keep the public safe? That's my first question.
With the rates of community transmission that we have in the district, the public's behavior for going to any business in the district should be the same, regardless of whether or not there has been a case in an employee or a patron at that business.
And my second question has to do with the DC jails. At 2 p.m. today, the inspectors that went inside the DC jails will be delivering the report to a federal judge. Has the Department of Corrections briefed you, Mayor Bowser, on how that visit went? And do you have any observations regarding what DC Department of Corrections told you about that visit?
I did get a briefing over the weekend or on Monday, and I can turn to Kevin to talk about any kind of preview that we got about that briefing. I think that the inspectors were there over the weekend and worked with our staff and team and had access to the jail. So Kevin can say a little bit more.
We've been fully cooperative with the inspectors. They spent the weekend there. They have confidential conversations with staff that we give them the privacy for. We were not given a preview as to the report. We'll find out about it when they report to the judge and the courts what they found, and we'll be cooperative after that report comes out with any findings and corrective actions.
Okay, we'll take another round. We'll start over here. You have any?
Yeah. Are we seeing any, with the homeless population, are we seeing outbreaks at any particular shelters? And the order mentions the importance of space out beds if possible. So are there any shelters that you're still seeing more than 10 people within close quarters of each other?
I'll ask Chris to talk about his operations branch, who is working very closely with DHS and Laura Zeilinger and her team. So let me turn to Chris.
Thank you, Mayor. In our larger congregate shelters, we're seeing larger reports of cases, so that would be logical how that happens. In every case where we can create space in the shelters, we're doing that. As you know, we have a large population in our shelters, so our process of moving those that are exhibiting symptoms out so that we lessen the amount of infection is our focus. Using the additional spaces that we have with the good partners in the hotels that we're working with, and pulling out the highly vulnerable populations out of the shelters is two ways that we're working on ensuring that we're stemming that tide the best we can.
And are the hotels just for elderly and vulnerable people, or for those populations and as a remote quarantine site?
So it's both. So we have certain hotels that are just for those that are the highly vulnerable population, and then the other hotels that we're using for those that are exhibiting symptoms, so they get tested, and we can either keep them in that setting as they convalesce, as Dr. Nesbitt said earlier, where they would normally be at home recovering from the disease. They'll be in the hotel rooms recovering from the disease.
Still 3 hotels?
No, we're actually working with 5 hotels right now.
And then either Mayor or Dr. Nesbitt, can you respond to the contention from nurses at St. Elizabeth? The city was too slow to take action and to provide protective equipment.
We have provided St. Elizabeth with all of the personal protective equipment that they need, in a full spectrum of personal protective equipment, as quickly as they have requested.
Okay, yes.
It's been a couple of days since you started doing the grocery pickup at schools. I was wondering how that was going. If you're seeing long lines of families come to get food, and if it's going to be enough, what other actions are you planning on taking to help expand food access?
Well, thank you for that. And we have been very aggressive about food access from the beginning when we announced our early spring break and modified schools, having meal sites throughout the city for students, as well as adding sites when we saw how parents and kids needed to be served. And we have been concerned from the beginning about the longer this goes, the more concerned we are about food insecurity. And so how we reach out to people who are homebound and how we provide, grab and go bag of groceries for families is very important. So I know that Director Geldhart and the DHS teams and all of our teams are looking, especially this week and next, to see what that demand is like and how we can deploy resources to support it. We're working with, I think, at least a couple of our nonprofits who do food security work all year to help us in this process. Anything else to add, Chris?
I think the mayor covered it very well. We had, the first day we did a soft launch on this on Friday, we saw 200 meals that we provided, or grocery bags that we provided. Monday was a weather day, so we saw a little bit less participation. Yesterday was extremely good participation. We did have, at the site that I was at yesterday, we do 2 per day. We had 300 bags of groceries to hand out, and we did dispense all of those in that day. We do have a process that we're looking over the next week to see what the participation looks like, and we have the capacity to ramp up if we need to.
So it's about 300 bags per site that you're handing out?
600 total per day, right now, as we get an assessment of what the need is.
And then a couple of weeks ago, I think you mentioned that you were looking on providing childcare for emergency first responders. I was wondering if you could update on that.
Yes, we continue to provide childcare, I think, at 6 sites.
7.
Is that right?
7 sites now.
7 sites. And quite frankly, I've asked OSSI to look at our continued need and if it would be warranted to expand eligibility, to check in on how that's working. We don't have robust participation at those sites. So we continue to look at it to see what's needed.
And who are those pockets of those child care sites for?
They're for hospital workers. Mark.
Can I just follow up on the extension to May 15th?
Sure.
You want to have a press conference on Friday with the school specifically, but can you give any indication to students or parents if schools will resume this year?
I cannot at this stage. As I mentioned earlier, that we are still meeting and talking with our public education team that includes public charter school leaders. And we want to examine every single option and then make that report to families. I said, I think last week, that we would not be opening after April 24th. So I wanted to make sure that folks know that we continue to work on those options and would share them as they are available.
And then, Dr. Nesbitt, you gave us a partial number the other day, and I apologize if you were briefing earlier and I missed it, but could you update us on hospital numbers, and do you have that broken down by hospital? Just there, I can't remember.
Have a promo.
All right, you're listening to D.C. Mayor Muriel Bowser there, giving an update on the situation here in Washington, D.C. She talked about a couple of different things. I'll hit a couple real quick, Steve, and then I'll turn it over to you. She talked about disparities among the African-American community, who's most vulnerable, and how they're going to deal with the most vulnerable. She talked about providing hotels to some of the homeless population, working with 5 different hotels. She talked about the situation at St. Elizabeth's. She also talked about trying to get a handle on what's happening at the nursing homes and a number of facilities in the area. She also talked about one of the other things she mentioned right toward the end there before we went off was providing child care. She said that there are 7 sites, but they're going to reevaluate that because they don't have a lot of participation. So they'll reevaluate that moving forward. Then I'll turn it over to you, Steve.
And we heard from a lot of viewers already as she was talking, saying they still have questions about unemployment and also small business loans. So the mayor's still working on getting some of those issues tackled. Perhaps the biggest news that will affect everybody that came out of this, she mentioned that D.C. will extend its emergency order until at least May 15th. She said, doesn't mean that May 16th we flip a switch and everything comes back on. She said that May 15th we will evaluate where we are. She's kind of looking at it as a check-in date, I believe were her exact words. Thanks for joining us today. We will have more updates throughout the day. We invite you to join us for the 5 at 4 p.m. with a complete wrap-up of all of the day's news, of course, and we will have updates on our social media and digital platforms. In the meantime, thank you as always. Make sure to tune in at 4 a.m. to see Wisdom's smiling face.
Have a good day.